Hi, I'm Dr. Kumiko, Doctor of Physical Therapy and violinist. And now for the video we've all been waiting for. I'm finally going to share more about the neck. If you have been following along my YouTube shorts on the forearm, they all finish with me saying, this comes from the neck. I will cover this in another video. And this is true for all of the muscles that are in your forearm and hand. There's a structure called the Brachioplexus. It's a big jumble of nerves, looks a little bit like spaghetti. They all are actually very organized in a specific way so that it can feed into the front side of your arm, the back side of your arm, and the inside of your arm. There are three main nerves that come out from the neck. These three nerves are the median nerve, the ulnar nerve, and the radial nerve. There are only two muscles in the forearm that are innervated by the ulnar nerve. That is the flexor carpi ulnaris and half of the flexor digitorum profundus. The other half of the flexor digitorum profundus is innervated by the median nerve. And there are 5 other muscles that are innervated by the median nerve. That is the
pronator teres, the flexor carpi radialis, the palmaris longus, the flexor digitorum superficialis, and the pronator quadratus.
And the rest of the posterior forearm muscles are innervated by the radial nerve. There are 12 of them, and it includes the
brachioradialis, the anconius, the supinator, the extensor carpi radialis longus and brevis, the extensor carpi ulnaris, the extensor digitorum, the extensor digiti minimi, the extensor indicis, the abductor pollicis longus, the extensor pollicis longus, and the extensor pollicis brevis.
You may have also remembered me talking about the anterior interosseous nerve and the posterior interosseous nerve. These are both motor branches coming off some of the main nerves, the median nerve and the radial nerve. The motor branches are what supply information to the muscles to allow movement to happen. The other branches are sensory, which gives us sensation to touch. The interosseous membrane, if you remember me mentioning that structure, basically divides the forearm into the anterior and the posterior compartments. Anything on the anterior side of the interosseous membrane will be most likely innervated by the anterior interosseous nerve, and anything on the posterior side of the forearm is most likely innervated by the posterior interosseous nerve. To get into a little bit more detail, the radial nerve comes from the neck, and right when it gets close to the supinator muscle is when it divides into the sensory and motor branches. That motor branch is known as the posterior interosseous nerve and is a deep branch. So any structure that comes before the supinator muscle or is a bit more on the superficial proximal side is going to be innervated by the radial nerve. The same thing is true of the anterior interosseous nerve. So when the median nerve comes out from the neck, it supplies the front of the forearm, but the deep muscles. These are all important things to know as a violinist because we hold it right here in between the chin and the shoulder, right up against the neck. We often get a lot of compression here because we are maintaining this position for long amounts of time, and we are using this to assist our playing with the forearm muscles. Knowing now that these nerves communicate with the muscles of the forearm, it's super important that the motor connections are strong and that the muscles stay healthy. Sometimes what can happen is compression in different areas, either in the neck or in the armpit or in the shoulder, in the elbow, or in the wrist. And this can cause issues with the mobility of the nerves, and this could lead to some tingling or some numbness in the hand even, or in the forearm. I personally experienced a little bit of this when I played several hours a day for practicing, playing in orchestras, and just being a performing musician. So it's very important to talk to your doctors and specifically physical therapists who can really help with these types of issues. As a quick little exercise, I want you to see how it feels if we put some of these nerves on a little bit of tension. The first nerve I want you to feel is the median nerve. This nerve comes from the neck, goes through the armpit, into the arm, and to the forearm, and into the palm of the hand. So, I want you to take your arm. I like to call this the pizza hold. Pretend like you're holding a tray of pizza with your hand. Squeeze your shoulder blade back just a little bit, and you're gonna start to extend your arm out to the side. You might start to feel some tension in your elbow, sometimes in the shoulder, but mainly you might feel this in your palm and in your fingers. So make sure that when you're reaching out, your fingers stay straight, your wrist is extended, and you straighten out the elbow until you feel a point of tension, and then you come back. This is your median nerve. The second nerve I want you to feel is your ulnar nerve. And I kind of like to think of this like Superman. You're making a little OK sign, pushing the fingers against the cheek and placing your fingers around the eyeball. If you have nerve tension, this may be difficult to do, so be careful, only do what you can, and you only need to go as far as you feel some tension starting in those fingers, especially the pinky and the third fingers on this one. So start with making an OK sign. You're going to keep your arm and your shoulder blade back. Keep your elbow bent. Start to reach your fingers towards your cheek. You may already feel it here. I already feel some tension in my pinky here, so I won't go much further. And then you can release. Start to reach those fingers towards the cheek. I feel it right there. And then release. The third and final nerve I want you to feel is the radial nerve. And this is the one that comes from your neck, comes on the back side of your arm, into the posterior side of your forearm, and into the fingers on the back side of your hand. So to feel this nerve, all you have to do is make a fist by first bringing your thumb in, and then covering it and wrapping it with your fingers. You're going to knock on the door, so keep your wrist flexed this time. And I like to think of this like you're trying to pour out an empty can of water. So you're going to start to reach and pour out that empty bottle of water out to the side. You should feel some tension along the forearm on the back side and a little bit on the back of your wrist, maybe in your fingers as well. So knock on the door. Start to pour out the rest of the water in your empty bottle, and you're trying to get rid of it, so make sure it's behind your back, and then you come back. Pull and release. So that was just a little fun exercise to show you where those nerves are, help you get a better understanding of how they might feel when they're on some tension, and it's actually a physical therapy exercise that a PT might give to you if you have any issues with the nerves gliding through the arm. I hope that this video was helpful and helped you gain a better understanding of the muscles of the forearm and the nerves that innervate them. Please go ahead and go back to the YouTube shorts that I've created, and you can see and review all the different origins and insertions of the muscles onto the bones and the nerves that innervate them. I hope you were able to also take some time to review the video on how to memorize all of these muscles so that you can sound smarter and also know more about your anatomy. I'm Dr. Kumiko, Doctor of Physical Therapy and violinist. Follow and subscribe for more.